Some of your blood cells fight infection. These are called white blood cells. Chemotherapy can affect the production of these cells in your body, so you are more likely to get an infection while you're having chemotherapy. You will have regular blood tests to see how your white blood cells are going. We'll check your white blood cells at the start of treatment to make sure they're okay. At the middle of treatment, your white blood cells are likely to be low. This is when you're at greatest risk of infection. We expect your white blood cell levels to recover in time for your next treatment. But if this takes a little longer than expected, your next treatment may be delayed until your white blood cell levels improve.
When we got to the hospital, the first thing that we had to do was I had to go and have a blood test. And I think the worst part of the whole day was waiting the hour until we could get the results of that blood test to know whether I was going to be able to have chemo.
Some signs of infection are feeling feverish, hot or sweaty, having chills, especially if you're shaking, redness, swelling or tenderness on the body, especially where drips have been placed, cough or cold symptoms, needing to go to the toilet a lot or having a burning feeling when you are urinating, and look out for sores in or around your mouth or a sore throat. If you notice any signs of infection, it's important that you take your temperature. The easiest way to take your temperature is by using a digital thermometer. If your temperature is over 38 degrees Celsius or 100 degrees Fahrenheit, contact the hospital immediately. If you have any signs of infection, but your temperature is normal, you must still contact your treatment team. While contact with some sources of infection are unavoidable, there are things that you can do to reduce your risk of infection. Washing hands before each meal and after going to the toilet helps to reduce the germs that can cause infection. While there's no need to lock yourself away, it is a good idea to avoid close contact with people who have colds, flus or other infections. You should also check with your doctors before getting any immunisations during your treatment. And if you're having high-dose chemotherapy, your treatment team may suggest some other things that you can do to reduce your risk of infection.
I did used to go to shopping centres, and I think I used to hold my breath sometimes if I thought I was near someone that had anything. Quite bizarre, but you sort of still had to live and exist, etc. And I did only actually get ill once. It was like getting hit by a Mack truck because your immune system was that low.